Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Hi, everyone. Welcome to the Transforming Healthcare Coaching Podcast. And we are so excited to be participating this year in the first ever worldwide charity event for Podcasthon, which is occurring this week in March 2025. And we are so honored to have Dr. Stefanie Simmons, who is the Chief Medical Officer of the Dr. Lorna Breen Heroes Foundation and a board-certified emergency medicine physician. She's been the primary advisor to the CDC for the Impact Wellbeing Guide for healthcare leaders, and has served for over 7 years as vice president for patient and clinician experience for a very large healthcare system and group, serving 26,000 physicians and advanced practice providers with a focus on professional well-being. And so we're super excited to have her on our podcast today as we gain some exposure for those who aren't totally familiar with what exactly is the Lorna Breen Foundation and what's all about. So I just don't know if you want us to say a couple words of hello or introduction to the Lorna Breen Foundation, what it's all about.
I appreciate that. Thank you. And I'm looking forward to the conversation. So my name is Stefanie Simmons. I'm a board certified emergency medicine physician, and so was Lorna. Lorna Breen was an emergency medicine physician practicing out of New York Presbyterian Hospital. She was faculty at Columbia. And like many healthcare workers, she came to the call when the COVID pandemic started. She led her department, cared for patients, worked tirelessly to serve her community. She ended up getting COVID herself, got quite sick with it, came back as soon as she was able to, like so many did, and then became exhausted, physically, emotionally, and mentally exhausted. She was hospitalized, and after her discharge, she died by suicide. And one of the things that she expressed to her family before her death was that she was worried that now that she had received treatment for mental health care, she was going to lose her license, she was going to lose her ability to work at her hospital, and she was going to lose her ability to lead other physicians. 3 things she had worked her entire life and career for.
Those are some of the stories that we didn't really realize back in the pandemic when we had heard, as an emergency physician myself, when we had heard of this, I mean, it was ground zero, the pandemic. It seemed, of course, and obvious. It would be normal and understandable to be going through so much stress and need to take a break and to be able to come back and lead. And I don't think anyone with the stories that came out afterwards, how well loved she was and how well respected she was. I
Yeah.
can't even imagine to think that that even would be in anyone's mind. And yet we as healthcare professionals, especially leaders, internalize this mythical story that we tell ourselves.
The New York Times wrote the story of Lorna's death, and what happened afterwards was first dozens and then hundreds and now ultimately thousands of healthcare workers have reached out to her family and now to the foundation that they started, the Dr. Lorna Breen Heroes Foundation, and said, Lorna is not alone. Other people are worried about this as well. Our state licensing asks us sometimes about the history of mental health care, diagnosis, or treatment. Our hospital credentialing questions sometimes ask about history of mental health care. Our professional liability insurance, our payer insurance can all ask these questions. And even if we were to say yes and nothing came of it, it does add a layer of risk and a barrier to something that's already hard, which is to ask for help when you need help.
Right.
And one of the major initiatives that the foundation has worked on is actually to get those questions that are unnecessarily invasive and stigmatizing around mental health out of the state licensing and hospital credentialing applications so that healthcare workers can feel more confident receiving mental health care, that they won't be at risk of losing their license and their credentialing application. And then once states change their applications, hospitals change their applications, we award a badge as a visible symbol that has happened and as a way for organizations to communicate with their healthcare workforce that the change has happened. Because it turns out New York State, where Lorna was licensed, doesn't ask about your history of mental health care on your state licensing application. And she didn't know that. The communication component of this becomes really critical as part of the discussion and how to change the stigma around receiving care.
That's huge. And I didn't even realize that either, that there are ways that individual people, you don't necessarily have to have a union or a group to come to the foundation to look for help. You can just place an inquiry in terms of, hey, look at my renewal. My renewal is asking this question. And obviously, things are different now, many years later. And I did seek mental health care. My health, my body, my mind. There's no reason why my protected health information needs to be relevant to how I answer this question. And yet, people are afraid. And so, people can come directly to the foundation for help.
With the organization or the state that uses the application to help them change. And so far, we've been able to recognize 29 states and over 500 hospitals who have not only made the change, but then had that change verified and received our badge as a visible symbol that the change has occurred. So we have new states, new boards, new types of medical professionals. So physicians, nurses, pharmacists, dentists are all involved in this challenge now. And then new hospitals and health systems getting involved every day.
That's super exciting. It just goes to show that although the professional organizations, no matter what profession you're in, is an agent and a method for change because there are
Mhm.
people who are interested in well-being at all different levels. And the best way is to go through those organizations so that they can partner with you to make it better and more equitable for everyone.
It always starts with one person. So there's always somebody who says, this needs to change. And we have resources, we have a toolkit on how to make this change happen within your organization, including who the key stakeholders are, who to have conversations with, and how to get engaged with our technical assistance program too, because we provide a lot of guidance for organizations who are making this change on how to be consistent with those best practices while still keeping patients safe.
That's super exciting. It also just goes to show what started with one physician now is really spread to
Mhm.
the entire house of healthcare. 'Cause I have no idea what the nursing paperwork looks like or the advanced practice
Mhm.
professional paperwork looks like. And there probably are similarities and redundancies and also complete differences in terms of how
Mhm.
things are phrased and what can be perceived. And so I think it's wonderful that the foundation is able to help in such a big way.
You know, I just wanted to take a quick second to say thank you. Seriously. It means a lot that you're here with us, diving into these real conversations about life and healthcare. If you're enjoying what you're hearing, we'd love to have you join our regular crew. Just hit that subscribe button wherever you're listening from. It really helps us keep these authentic conversations going. All right, where were we?
So the foundation has really also been in Congress too, really being instrumental in advocating for policy changes. And so that's something for many of the frontline healthcare professionals, we have really no idea or very little understanding for how policy can be helpful to us. And so things that I think that you might have worked on have been things about those questions from the licensing at the state level. Aside from that, what other work has been done and what other work still needs to be done?
So the Dr. Lorna Breen Heroes Foundation advocates at the state and federal level for changes that impact the professional well-being of healthcare workers. And yes, at the state level, that has often included licensing changes or statewide credentialing application changes, but have also included things like state level prior authorization reform to help reduce administrative burden on healthcare workers and streamline procedures for healthcare workers. At the federal level, the Dr. Lorna Breen Healthcare Provider Protection Act that was signed into law was the first federal legislation that specifically looked after healthcare worker well-being and mental health. And there were really three large segments of work that came out of that. There was the Impact Wellbeing Campaign, which provided resources for hospital leaders on how to improve the professional well-being of their workforce. It led to the development of the American Hospital Association's Healthcare Worker Suicide Prevention Guide, and it also provided grants to over 40 organizations to enhance and improve their professional well-being program and to do some research on what works in improving professional well-being for the healthcare workforce. Currently, we're in the process of reauthorizing and refunding the Dr. Lorna Breen Healthcare Provider Protection Act. And that's our major federal initiative at this time.
That's really wonderful. And I think my understanding is that this is a bipartisan support. It doesn't really matter. This is beyond politics, the care for the healthcare professional.
Absolutely. From the beginning, the Dr. Lorna Breen Healthcare Provider Protection Act has had bipartisan sponsorship and support. And it really speaks to the fact that everyone has a hospital or a health system in their district. Everyone has potential patients, i.e., every single one of their constituents in their district. And the healthcare infrastructure of our country, the ability of our physicians, our nurses, our pharmacists, our dentists to care for our population matters to everyone and really transcends political ideology.
Yes. And so I think the great thing too is this provides networking amongst many larger organizations to recognize that the wellness of healthcare professionals is important for everyone. And so system to system, even thinking through what's working for you, your employee retention, your well-being programs, what's cost effective, what's successful. Because what we've noticed, at least in our transforming healthcare coaching, is that when we coach different people across the country, similar problems are there no matter where you are and no matter what discipline or profession you are. And so some things are common in terms of human flourishing and being able to live up to your potential and also deal with the stress of just working in a healthcare system that's quite large.
And constantly in flux. So there's this constant change that's happening in healthcare. The the rapid advances in technology, the rapid changes in how healthcare is delivered, the system in which we deliver healthcare, these are all changing at a rapid rate. And organizations really need to work together and adopt leading practices in order to be able to keep up. And so one of the ways that we're helping organizations at the state level to keep up is through our All In Caring for Caregivers program. And what we do is we work with a statewide coalition, and that often includes the hospital association, the medical society, the nursing association, the pharmacists, the health informaticists, we're all working together saying we want to make a difference in professional well-being. And as a state licensing is addressed, hospital credentialing is addressed, hospital and health system leaders have access to and complete education around the drivers of burnout, how to address them, the leadership that's needed. And then we form a learning collaborative for the organizations within the state to learn from each other and from national leading practices on how to improve the workforce environment of care. So far, we have All In Caring for Caregivers in Virginia, North Carolina, and New Jersey, with several states to come. And we're seeing that these learning collaboratives really form a powerful relationship for our organizations to learn from each other. And it forms that rising tide that sort of lifts all the boat in the state.
That's really wonderful. I mean, I just realized I'm close to all of these states, but Pennsylvania is not one of them then. Yeah.
We would love to see All In Caring for Pennsylvania's caregivers.
That would be awesome. And so hopefully we can be part of that story together. And so I think you have a summit coming up soon, the foundation. Could you tell us a little bit more about that?
Sure. March 18th is Healthcare Workforce Wellbeing Day. It was declared by Congress last year as the first Healthcare Workforce Wellbeing Day. And it's also the anniversary of the signing of the Dr. Lorna Breen Healthcare Provider Protection Act. So special for us in two ways. Last year, for the first time, we partnered with Johns Hopkins School of Business and School of Medicine and celebrated the Healthcare Workforce Wellbeing Day with a summit on healthcare culture and leadership, and how culture and leadership can really be the thing that drives professional well-being in an organization. So this year we have our second summit, and we're looking forward to the conversation, the gathering of colleagues who are all committed to and interested in this area, and the learning that comes out of that.
That's awesome. It's funny. I just think about the well-being groups that I'm in locally, and it really does take a village, a huge village, maybe a city, to really be able to try to change the culture in general. And so when we think about all of us little individuals who just have interests in how do the individuals inside a system help contribute to the cause, I guess, if you had advice to give to the regular individuals.
So, yeah, so the first thing I would say is put your own oxygen on first. Make sure that you are taking care of yourself, your department, the people around you, and then out of the things that you learn in doing that, think about ways to expand within your sphere of influence that change. And so think about looking at your hospital or health system's credentialing application. What could be changed? Talk to your med staff services, submit the application for review at the foundation, and ultimately work towards the badge. We also have an ambassador program for leaders in healthcare workforce well-being, for people who are passionate about this, have made this their career. We put those folks into community with each other, and they help to promote the goals of the foundation and of healthcare workforce well-being nationally. You can also talk right to your state board if you are a healthcare worker, if you're a physician, a nurse, a pharmacist, a dentist. To your state board, we have a tool on our website and a link in the comments on how to do that. And get involved in advocacy. Every professional organization in healthcare is involved in advocacy in some ways and helps to make change at the state level and at the federal level for their organization. And for many of those organizations, professional well-being is part of that advocacy work. And so think about getting involved, learning what your organization is doing, and lending your voice and your story to those efforts, because we need to share in our profession what's happened to human beings that are doing this work. But we also need to educate and inform people outside of medicine and outside of healthcare about what our colleagues are going through as well.
Yeah, I love that. I think also you just start to realize you're one person, after your oxygen mask is on, if you can glow and sort of make your group a little more healthy, and then from there, your division, your department, and then most of us work interprofessionally, so then you accidentally, "Oh, it's your pharmacists, your, nurses, all also kinda come along for the ride," and really whatever program you put together or whatever ideas can be shared freely, 'cause information is free,
That's
and
right.
positive energy and attitude is free, and the desire to make the workplace a better place is often as little as one person's attitude can make such a big difference.
It can make such a big difference, and we control a lot less than we like. There's actually very little we control other than our own reactions to events, but we have much more influence than we think we do on
Yeah.
the people around us, but also on the policies of our organization, on our state politics, and the ability to have conversations about how things are done in healthcare. And then there are things that are out of our control that we also need to learn to accept and just focus on what we can control in our day, and what we can influence in our day. And so that learning of controlling what you can, influencing and impacting where you can, and then also not being so distracted and scattered by the things you can't influence and control that you don't get anything done in those other areas. It's important for people to focus on where they can make an impact.
Hey, I'm loving where this conversation's going. And it actually reminds me, if any of this is hitting home for you, I just wanted to let you know about something pretty cool we've got going on. We've got this amazing team of 5 coaches who really get what it's like to be in healthcare. And they're available for one-on-one sessions if you want to dig deeper into your own journey. Plus, we've created this whole community called Med Thrive. Think of it as your professional growth space with self-paced learning and monthly group coaching calls where we all support each other. Just putting that out there in case it speaks to you. You can check it out whenever you're ready. Now, let's get back to this great conversation.
Yeah. So as energy leadership coaches, we often are coaching executive leaders or division chiefs. And so inside the healthcare system leaders, if they really is part of their servant leadership style or whatever they are sort of believe in value wise, if they really want to prioritize a really well group, a really well hospital, really well department, what are the most impactful changes that you've seen? Because you get to see all of this amazing change across so many states and so many hospitals. What are the most impactful changes that you've already seen that maybe other groups might want to hear about that they can implement today? Small little things that you've been able to see successful.
So the NIOSH Impact Wellbeing Guide was created exactly for this reason, which is to give healthcare leaders 6 steps, things that they can get started away that will make an impact on the professional well-being of their healthcare workforce. And I'm going to run through the 6 steps. I won't go in depth into any one of them, but because we could be here all day talking about them, but The first step is really to understand what's already happening that works and make sure that doesn't go away and expand on it if possible. The second step is really to eliminate the sources of stigma. So look at your licensing, look at your credentialing, change what you're credentialing at your hospital, look at your policies and procedures and make sure you're not stigmatizing seeking mental health care or taking care of yourself. The third is to communicate, like the why you did that, the fact that you did it, and that you as a leader have a commitment to this. Because the assumption is going to be the opposite unless you communicate that. And then once you've communicate some more and really think about how to set up a two-way communication system where people can feel comfortable bringing issues to you, things that could be improved in the environment, and that you're able to then communicate back either why it can't be changed, which sometimes is the case, that it can be changed and what the timeline is, or in the case of something that can just be changed, that you've changed it and it was due to their feedback and thank you. The next thing is really to think about how we can incorporate professional well-being into quality improvement. Every hospital, every health system has quality improvement projects going on all the time, but we sometimes will work on quality improvement at the expense of the people doing the work. Work harder, not necessarily more efficiently, but harder to get this done. Add this thing to your work queue that may improve quality and safety by incorporating the impact on the workforce and making sure that human factors engineering is used, that the way the work is done does not add steps, does not add burden. We actually improve overall quality and safety by preventing burnout of the healthcare workforce as well. Once you've done that once, you need to spread that all over into all of your processes. And then start to think about peer support, about measurement, and how you want to address professional well-being over the course of the year. So start small, baby steps. You don't have to fix the entire healthcare system in order to make things better at your organization. And if you're looking for the first few bites, the Impact Wellbeing Guide is a great place to start.
That's really wonderful. I especially like the communicate part because I even just knowing that certain policies are changing, and even if it's always perceived as, well, what's the real reason why? Could it be because of money? Could it be because of, well, no, it's actually because it's not to make somebody work these many hours, or it's not to do something in the way we had always unspoken rule. We're just trying to put some boundaries up to keep everyone safe. If you can volunteer for more shifts if you want, but you're not mandatorily required. Certain policies in place, for example. When things change, people get a little upset, and realizing that it doesn't mean you can't voluntarily choose different things. And also, we want to try to keep things safe for everyone as a bare minimum. I also really liked your idea about the fact that in the end, you're going to probably have to keep on reiterating because at each new person, each new authentic identity comes into the group. You're going to maybe have different things that you may not have seen as something that used to work for a particular group. And this often happens with women who join a more male dominated group, like family dynamics and what's considered important in terms of potential gender care and caregiving for the elderly and for little children. What's normalized, it doesn't always work. And so changing what's well for the group often modulates depending on the age of your particular group and medical illnesses in your group, and having the flexibility to not run a lean system and to instead realize you're going to have issues. And so how will we come together to be flexible enough to handle those times?
And that realization and that flexibility really ends up benefiting everyone in the group because very few people get from day one in their career to day end in their career without some need for flexibility, whether that's as they age and they need different hours or schedule, whether they have an injury or an illness and have a temporary or permanent disability. Childbearing, certainly, but child rearing as well, as you mentioned, caring for elderly parents. Like all of us are human beings, and like these issues affect every single person. And so by being forced to confront the humanity of healthcare workers, groups, and organizations, end up crafting a work environment that's more human for everyone.
Yeah. And it's so often in the front lines, the frontline managers and the assistant managers and people just doing the schedule. It's really the very first place where the friction, the tension occurs. And so even if you have policies and HR, people well above you are totally like all on board for flexibility and redundancy, it trickles down, which means that really it's everyone's responsibility to think about well-being. It really isn't just the chief wellness officers or the division chiefs. It's everyone all the way down to each and every person in the group.
And that's where your leadership really comes in. Your immediate leader, whether you're a nurse, then that's the charge for your unit, or you're a physician, it's your medical director, or a pharmacist, and it's the pharmacy lead for your unit. Like that immediate leader is key to your experience of work. And you cannot lead bad policies. It's exhausting and it's not great for people, but you can do it. It's really hard for good policies to make up for a bad immediate leader. And of course, ideally you have both excellent policy and great leaders, but you really can't underestimate the impact that frontline leaders have on the workforce. And some of those folks are experiencing the worst burnout of anyone because they have the work stressors and the work resource mismatch of a healthcare worker, and then the work stressors and the work resource mismatch of a leader. And they're constantly having to balance and translate between those two groups. And that's a very difficult position to be in.
Yeah, absolutely. And I think for those of you listening that are in that role, also recognize that what you do in that moment of the request is indelible. To be able to first see the human in front of you, not like your employee or your nurse or whoever it is you're talking to, is just when you're just a person, because for them to have come to you is very vulnerable and very hard, and it's very embarrassing to come with trying to figure out that flexible schedule. Like, how are we gonna make this work? They just to be respectful in that moment is so important because in that split second, you realize, am I gonna have a leader that's gonna be willing to work with me? Or is this a leader who's gonna recommend that I probably should go look for a different job? And this is where it begins, where sometimes we leave for things that really could have been easily resolved. And that doesn't have to be the case, especially when there's structures and policies in place that to support you as the frontline clinician.
Absolutely. And to this day, still have so much gratitude for one of my early leaders who not only responded positively to my need for flexibility, but shared his own experience and normalized it. So
Mhm.
it wasn't only, yes, we'll make this work for you. It was a, yes, this will make this work for you. And far from shaming or marginalizing you for this, I'm going to share with you how this played out in my own life and really make you feel like you belong and are included in the group. So there are lots of ways that leaders can make a difference. And that's certainly one of them.
Yeah. And so for as we sort of come to a close, whether they're healthcare leaders or workers in the front lines or advocates, what's one tip or piece of advice that they can do now to help move the needle for everyone having better access to mental health and normalizing the stigma about mental health and healthcare that you'd like to share?
If you work in a healthcare setting, regardless of what that is, there's likely somewhere that you interact with a credentialing application, a licensing application in your hospital, in your health system, in your urgent care, pharmacy, et cetera. Take a look at that. And if there's any question about past history of diagnosis and treatment of a mental health condition, advocate for that to be changed. Because we know that for health workers, concern to having their privacy violated about their own physical and mental health care is one of the reasons they don't receive care. So advocate for that to be changed. Use our toolkit for help. Get the badge, communicate that out to your coworkers. We have dozens and now hundreds of examples where individuals have led this work and been able to get things changed and make the environment a better place for not only them, but all of their coworkers as well.
That's super inspiring. One person, just takes one person, one form at a time, one electronic form at a time. So I got throw in one last question just for fun. What's your favorite part about this job? I've never been able to ask a wellness leader what because it's hard work. It's hard work working for a nonprofit. Sometimes it feels like you're always swimming against the waves. But what's your favorite part about working with the foundation and implementing change and doing things like this?
It's an easy question to answer because the answer has been the same the whole time that I've done this work, regardless of the setting I've done it in, whether it's as a CMO of a nonprofit or the VP for patient clinician experience in a big organization. It's the people. And it's the people who are drawn to do this work that I get to work alongside are compassionate, intelligent, systems thinkers who see both the individual, but also the environment that individual's in, the system that environment is part of, and work to change that for the better on all levels. And so the people are remarkable. I'm privileged to work alongside my colleagues, both within the foundation and with our partners. And that is absolutely the best part of the job.
Oh, that's so awesome. Oh, so thank you everyone for listening to the Transforming Healthcare Coaching podcast. And thank you so much for the foundation and Dr. Simmons for being here with us today. And please like, share, and follow us. Feel free to leave comments in the area below. And for more topics that you're interested in us either bringing guests on or to have topics covered, please email us at podcast@transforminghealthcarecoaching.com. Thanks, everybody. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.